MCV, mean corpuscular volume. The mean corpuscular volume is the average size of your red blood cells. MCV indicates the average red blood cell's size and volume. The red blood cell is said to be abnormally larger, called macrocytic, when the MCV value is high. The red blood cell is said to be abnormally small, called microcytic, when the MCV value is low. Purpose of MCV. This parameter is used to diagnose different types of anemias and other health condition. Normal value of MCV in blood: 80 to 96 fl, femtoliter. Specimen collection. Collect 3 to 5 milliliters blood in EDTA tube. MCV calculation. MCV equals % hematocrit PCV multiply 10. Divided by red blood cells. Cause of high MCV. Vitamin B12 deficiency. Deficiency of folic acid. Liver disease. Hypothyroidism. Autoimmune disorders. Aplastic anemia. Hemolytic anemia. Chronic alcoholism. Normal pregnancy. Reticulocytosis. Newborn. Megablastic anemia. Cause of low MCV. Iron deficiency anemia. Thalassemia, beta thalassemia minor. Spherocytosis. Lead poisoning. Sideroblastic anemia. Anemia of chronic disease. Increased in megaloblastic anemia, hemolytic anemia with reticulocytosis, liver disease, and normal newborn. Decreased in iron deficiency anemia, thalassemia, sideroblastic anemia, and lead poisoning. MCH, mean corpuscular hemoglobin. MCH value indicates to the average quantity of hemoglobin present in a single red blood cell. When the MCH value is high, the red blood cell is said to be abnormally larger, called macrocytic. When the MCH value is low, the red blood cell is said to be abnormally larger, called microcytic. Purpose of MCH. This parameter is used to diagnose of anemias. Normal value of MCH in blood: 27.5 to 33.2 picogram. Specimen collection. Collect 3 to 5 milliliters blood in EDTA tube. MCH calculation. MCH equals hemoglobin in grams DL multiply BY10. Divided BY red blood cells counts. Cause of high MCH. Vitamin B12 deficiency. Deficiency of folic acid. Liver disease. Alcoholism. Cause of low MCH. Iron deficiency anemia. Thalassemia. Increased in macrocytic anemia. Decreased in microcytic, hyperchromic anemia. MCHC, corpuscular hemoglobin concentration. MCHC value indicates to the average concentration of hemoglobin in grams per deciliter present in red blood cells. When the MCHC value is high, the red blood cell is said to be abnormally larger with high hemoglobin, called macrocytic. When the MCHC value is low, the red blood cell is said to be abnormally small with low hemoglobin, called microcytic. Purpose of MCHC. This parameter is used to evaluate the severity and cause of anemias. Normal value of MCHC in blood: 32 to 37 grams per deciliter. Specimen collection. Collect 3 to 5 milliliters blood in EDTA tube. MCHC calculation. MCHC equals hemoglobin in grams DL multiply 100. Divide by HCT. Cause of high MCHC. Vitamin B12 deficiency. Liver disease. Autoimmune hemolytic anemia. Hereditary spherocytosis. Severe burns. Chemotherapy drugs. Overactive thyroid. Cause of low MCHC. Deficiency of iron. Celiac disease. Crohn's disease. Peptic ulcers. Hemolysis. Hookworms infections. Lead poisoning. Cancers that cause internal blood loss. 32-37 GDL MCHC indicates normochromic RBCs. Less than sign, 32 GDL MCHC indicates hypochromic RBCs, which is seen in iron deficiency and thalassemia. Greater than sign, 37 GDL MCHC indicates a possible error in RBCs or hemoglobin measurement, or the presence of spherocytes.